Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The symbols used for charting are shown at the top of the periodontal chart. There are symbols for missing teeth, food impaction, open contacts, mobility, bridges, drifted or extruded teeth, beginning furcations, exposed furcations, and periapical areas. Mobility of the teeth is recorded in the squares both here and at the base of the chart. The buccal and lingual aspects of the teeth are labeled on the chart. This is the buccal of the maxillary teeth and the lingual of the maxillary teeth. The chart is divided into millimeter markings, which are an aid to marking the depth of periodontal pockets on the chart, and the cementum enamel junction, the reference point from which the measurements are made, is indicated in these areas. Now let me see if I can demonstrate the use of the symbols for charting on this chart. Let's assume that we are missing tooth number 1 and tooth number 5. That there is an area of food impaction between 2 and 3. Sometimes you may have an area of food impaction even though the contact point is not open, particularly if there is a plunger cusp. There's an open contact, however, between 2 and 3 and 3 and 4. The mobility of the teeth is number 2 has a mobility of 1, 3 has a mobility of 2, and 8 has a mobility of 1. There is a bridge replacing tooth number 5 with 4 and 6 as abutments. Tooth number 4 has drifted mesially. The buccal of tooth number 2 has a beginning furcation involvement. As the furcation involvements are marked right at the furcation. The buccal of tooth number 3 has an exposed furcation. That means we can insert the periodontal probe all the way into the trifurcation area. The mesiolingual of tooth number 3 has an exposed furcation. It's wide open. Tooth number 8 has a periapical area. Recording the symbols for charting, I would then begin by recording the pocket depth in excess of 3 millimeters. And if you were calling these out to an assistant, we would begin on the distal buccal of the last tooth, which is number 2. And we begin like this. 4, 5, 4, 3, 7, 6, 4, 3, 3, 3, 2, 3, 3, 3, 4, 3, 2, 3. After you have recorded the buccal pocket depths, I would then proceed to the lingual, beginning on the distal lingual of tooth number 2 again, and recording only those pocket depths in excess of 3 millimeters. 4, 5, 5, 5, 8, 8, 4, 3, 3, 2, 2, 3, 3, 2, 4, 3, 2, 3. Once the recording of the pocket depth has been accomplished, I would then proceed to record the level of the free gingival margin in relationship to the cementum enamel junction on those teeth with pockets or those teeth with gingival recession. And the teeth that would qualify in that category would be any tooth that has a gingival margin apical to the cementum enamel junction. I would begin on the first tooth here that has pocket depth recorded, and on measuring from the distal of tooth number 2, the first measurement is 2 millimeters. The free gingival margin is 2 millimeters from the cementum enamel junction. So we mark a little dot here. And then we have 1 and 2. The next tooth that has pocket depth is tooth number 3. And we are recording 2, 1, 2. Next tooth is number 4, and that's 0, 1, 1. And the next tooth is 7. That's 0, minus 2, 0. Anytime the free gingival margin is apical to the cementum enamel junction, a measurement is recorded as a minus number. Now, moving to the lingual of tooth number 2, which is the first tooth again that records pocket depth, we have 4, 1, 1. This is a very common condition, to have the gingival margin quite high on the crown of the tooth on the distal lingual of upper molars. This many times happens on the distal buccal of lower molars and sometimes the distal lingual of lower molars. And so be sure to watch for that. The next tooth that has pocket depth is tooth number 3, and we have 1, minus 1, 0. Tooth number 4 is 0, 0, 0. In this case, the free gingival margin is at the cementum enamel junction. And on tooth number 7, we also have 0, 0, 0. Once the dots have been recorded indicating the level of the free gingival margin, I would then take and connect them, which gives you a graphic representation of the level of the free gingival margin. All been given periodontal charts, and while I'm charting the patient and the assistant is recording the data on the chart, I would like you to also record the data on your own chart. When we have completed one quadrant, then I would like you to compare your chart with our chart. First of all, I would like to explain to you the use of the periodontal probe for measuring the distance between the free gingival margin and the cementum enamel junction. Generally, the probe should be angled out at an angle of approximately 45 degrees from the tooth, entering the sulcus area and eventually encountering the area of the cementum enamel junction. In this case, we'd have a measurement of about 1 millimeter between the free gingival margin and the cementum enamel junction. In some cases, where the gingiva is tightly adapted around the tooth, you may not be able to angulate the probe out quite as far as 45 degrees, and a compromise must be made in this angulation. In some areas, the cementum enamel junction may be obscured by calculus. If this is true, then it's necessary to go in there and remove the calculus before you can measure the relationship between the free gingival margin and the cementum enamel junction. And this would happen in an area such as this. You notice here we have a heavy bridge of calculus on the lingual of these lower anterior teeth, and the calculus tends to obscure the cementum enamel junction. Can you turn your head just a little bit like this, please? That's fine. And in order to make a viable recording here, we would have to go in here and remove some of the calculus from that root surface. Now, once the calculus has been removed, then you should thoroughly flush out the area so that the hemorrhage that's produced does not obscure the cementum enamel junction. In measuring pocket depths, I would like to have you angle the probe toward the apices of the tooth. And I'd like you to come in at an angle approximately like so, until you encounter the depth of the pocket. 3 measurements will be made on each tooth, both for the recording the distance between the pregingival margin and the cementum enamel junction, and 3 measurements will be made to record the pocket depths, both at the mesial buccal, the midpoint on both buccal and lingual, and the distal buccal. These same measurements will be made both on the buccal and the lingual of the tooth. Now, let me demonstrate the charting of this quadrant on the patient. We'll try to split the screen here so that you can see me charting at the same time that you can see the data recorded on the chart. I think that when you're using an assistant, it would be well for her to call out the areas that you would like to chart, and then you can give her the pertinent data. All right, now let's begin the charting.
Missing teeth?
Tooth number 1 is missing.
Food impaction?
There is food impaction between tooth number 4 and tooth number 5.
Open contact?
There's an open contact between tooth number 8 and tooth number 7.
Mobility?
Open very wide for me, please. Tooth number 2 has a mobility of 1. Four, 1. 5, 1. That's all.
Bridge?
There are no bridges.
Drifted and extruded?
No drifted or extruded teeth.
Furcations?
Can you turn away from me just a little bit here, please? Furcations, as I mentioned before, recorded usually on the buccal with the use of Cowhorn Explorer. There's a beginning furcation involvement on the buccal of tooth number 2. And a beginning furcation on the buccal of tooth number 3. Can you turn your head way over toward me now, please? Many times you'll find it useful to use a 17 Explorer to explore furcation involvements on the lingual. There is a beginning furcation involvement on the distal lingual of tooth number 3. And on the mesial lingual of tooth number 3. No other furcation involvements are present.
Periapical area?
There are no periapical areas. Recording of the charting symbols, I would then begin charting the pocket depth, beginning here on the distal buccal of tooth number 2. Close down just a little bit for me. Open just a touch there. That's fine. We have 4, 3, 4, 4, 2, 6, 6, 2, 2, 2, 2, 3, 2, 1, 3, 4, 2, 2, 3, 2, 2. I would now move to the lingual and record the lingual pocket depth, beginning with the distal lingual of tooth number 2. Turn your head toward me, please. Four, 4, 6, 6. Can you open a little wider, please? That's fine. 3, 6, 6, 3, 3, 3, 2, 4, 4, 2, 3, 4, 3, 3, 3, 2, 4. Now, on the completion of recording of the pocket depths, I would then record the free gingival margin only on those teeth that have pockets or have gingival recession. And if you were charting yourself, I would go back to the chart and check those teeth. If you're charting with an assistant, she can call out those tooth numbers to you.
Tooth number 2.
Turn your head a little bit this way, please. Close down a little bit. Turn a little bit more that way. Two, 2, 3.
Tooth number 3.
2, 2, 3.
Tooth number 4.
3, 0, 2.
Tooth number 7.
2, 2, 2.
The lingual of tooth number 2.
Turn your head a little bit this way, please. Two, 2, 2.
The lingual of tooth number 3.
2, 1, 3.
Number 4.
3, 2, 2.
Number 5.
2, 2, 3.
Number 6.
3, 2, 3.
Number 7.
3, 2, 3.
Number 8.
2, 2, 2. Once you have completed these measurements, I would then complete the chart by filling in the dots indicating the level of the free gingival margin on the tooth, drawing vertical lines in an apical direction indicating the pocket depths, and I would make these lines adjacent to the roots of the teeth. And now that the chart is complete, please compare your chart with ours.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.